Hi friends, hola amigos. My name is Carla Colin. I am the program manager for the Latino Chamber of Commerce of Boulder County. And we are here for a COVID update with Dr. Lizbeth Mendoza from Boulder County Public Health. Welcome, Dr. Lizbeth Mendoza. Thank you so much for being here. It's been a few weeks since we talked the last time, and we are ready for the update, even when we don't have the best news. But there is things to do that can make them better. How are you?
Hi, Carla. Well, I'm very good. Thank you. How about you?
Good. Thank you.
Well, thank you so much for having me here. And thank you to everybody who is attending this update. So at this point, our community level of COVID is still high in Boulder County. And so is the level of transmission. And if you want, for you to remember that transmission levels, they apply more to the healthcare centers than to the community. What we use as a community is a community level, but it's important to know anyways, because that speaks to what's the level of stress that our healthcare systems are suffering. So how do we know that this is the case? Well, because we have a lot of cases. We have also hospitalizations, admissions to hospitalizations related to COVID, and those are high. We gotta be then attentive to extreme measurements because we don't want to have our systems collapsing. And at this point, they're being very stressed. So yeah, when we look per age, what's happening? Okay, so we are in this, high level of community, COVID community. Now, per age, in the last 7 days, we have seen that pretty much all the ages are diminishing in the concentration of numbers of cases of COVID. Nevertheless, when we try to see closer to each group, we see that there's more like the accumulated cases over the 7 past days are higher among people 75 and older and people between 35 and 44 years. That's where we see more, let's again say, concentration per age. But when we look at the number, like the absolute number in cases, we see that the most are between those 23 to 34 years old. So it's like the young people having more cases, but the elderly, they're having a more concentration per age. But in absolute, is these young people, which is something that is been seen all along. Like, young people tend to be more often diagnosed, or at least, diagnosed and counted than the elderly. Nevertheless, the ones that suffer the disease and more, severely are the elderly. So we gotta be careful with that, more concentration of severe illness in those ages. So what that means also is not only that we have to continue using, our normal preventive measurements that we all know now for COVID or any infectious disease, like washing your hands for 20 seconds at least, like not visiting people who are prone to getting severely ill, and so on. But also, of course, like any infectious disease, get vaccinated. We have the vaccines, and we have now 4, and we're going to talk about that in a little bit. But now we have more options to get vaccinated, and all of them have proven to be safe and effective, even in Omicron, and during the Omicron stages. Yes, the effectiveness or efficacy may be seen a little diminished, but it's still, they are conveying a good level of protection. So get your vaccine and get your boosters. That's the other thing. Completing the primary series, which is 2 doses of Pfizer and Moderna or 1 dose of J&J, is not anymore enough because of all these mutations. So now you really want to get your boosters. So just be attentive of when do you need your booster. Check with your provider, check on the website, etc. But like in a quick way to put it, anybody who is 50 and older right now should be receiving a second booster. And whoever is younger than that right now should be receiving a first booster. Don't forget that. 5 and up. And of course, always those who have some sort of like immune deficiency or some weakness in the immune system might be eligible for more doses, like a second booster, even if they are younger than 50. So again, just think about what is your particular case. And for that matter, I just want to quickly add a little commercial. Although there's a lot of vaccination clinics still, we have a lot of mobile clinics in buses, like one that we're going to talk about shortly. We also have those permanent clinics that you can access to, like in the supermarkets, the pharmacies, your hospital, but also us, Boulder County Public Health. We have a permanent clinic on Thursdays from 3 to 7 p.m., a great time to go. And there you're going to be receiving, and this clinic is in Longmont, just so you know. This clinic is in Longmont, in the Longmont Hub. There's like a community services center, and you are gonna get $100 gift card when you complete or you take your second dose of Moderna and or Pfizer, and you complete or at least one dose of the J&J. This is only for people 18 and older.
Perfect, Doctora. This is great information, and I know a couple of weeks or a few weeks ago when we talked the last time, the vaccines for the little ones, for the babies, were coming up. How are we doing on that?
Yes, that was a great one. So yeah, finally we have the vaccines authorized for the little ones younger than 5. And at this point, it's been about a month, a little over a month, that the authorization came in for these folks. And during this time, approximately 15% of our kids under 5 years old, they already have their first dose. And because of all these weeks have passed, some of them have also been receiving their second dose. That means completing their series, their primary series. And but only a little less than 2% of the kids have already received their second dose, completing their primary series. So, and this is not something that we are feeling too bad about, the fact of the second dose, because you know the vaccine in the little ones, you can get a second dose between 3 or 4 weeks and up to 8 weeks. So probably some of those parents are waiting, oh, I want to give my little one a vaccine in 5 weeks instead of 3 weeks or 4. So that's fine. And so we need the time to go to pass. But please don't forget to take your little one, because it's super important to complete the first series, the primary series. Like in adults, the same. That's the goal to begin with. And of course, the next goal is to complete the boosters to stay up to date for people 5 and older. So that's the case of the little ones. It still is not exactly where we thought it was going to be. We know that parents have a lot of questions and a lot of, you know, information to deal with. And I mean, one thing we want to tell those parents is that vaccinating the kid really does not represent the risk that you're thinking. It's more risky. It's actually absolutely more risky to not vaccinate your child, because the problems associated with COVID are much more prevalent, are evidently happening. There's a chronicity to it too. So, you know, there is no evidence that any kid has died because of the vaccine, the COVID vaccine. Therefore, you know, you can't even compare, but we do know that a lot of kids have died from COVID, more than 400 in this group. So, you know, no deaths in vaccines, but yes, that with COVID. No chronic conditions with the vaccines, but yes, with COVID. No more prone to developing diabetes with the vaccine, but yes, with COVID. Chronic inflammatory syndrome, not with vaccines, just with COVID. So there are so many, you know, things that you can compare and see how not vaccinating your child is way more risky than expecting your child to get sick if they get sick. I'm thinking that they don't usually get sick, but they do. They contract the virus. So it's more risky not to vaccinate them than to vaccinate them. If you have any questions or you want to learn more data, please feel free to reach out to us.
Sounds good, Doctora. Thank you so much. And I just want to mention, and I want to show my gratitude to Doctora Lizbeth Mendoza and Boulder County Public Health, because thanks to them, we are gonna have another mobile vaccination clinic during our Fiesta and Food Truck event on September 24th in Longmont. So stay tuned for that because we're gonna have more information coming up. But this would be our third vaccination clinic of this year. So it's only a few months or maybe half the year, and we're already scheduling our third vaccination clinic, and I am so happy about that. You can come and enjoy time with your family, with the community. It's going to be in an open space, so we're going to be totally safe, and you can have food, you can dance, you can listen to music while you wait for your turn to get vaccinated or get your booster. So please, please, please feel free to come. It's free entrance. We are not going to charge the entrance to these events, and it's open to the community. It's not only for businesses, it's for anyone in the community to come and join us. And it is a family event. So you're going to be able to bring your kids, to bring your abuelita, to bring anyone in the family to join us for these events. So, and hopefully Dr. Lizbeth Mendoza can stop by and be there with us for a little bit and maybe answer some questions that you might have. But yeah, I really encourage you to, and if you're vaccinated already, come to the event anyway. So you don't have to come just to get vaccinated, but anyone is welcome to come to these events. And it is going to be on September 24th. You're going to see more information on our website. And if you're on our contact list of the Latino Chamber, we are going to make sure that you receive the information for the event. So Dr. Lizbeth Mendoza, I don't know if there is anything else that you would like to add, but thank you so much for being here today.
No, thank you. And thank you for hosting another clinic. Those clinics are super fun with Latino Chamber. So don't miss the fiesta. Even if you don't get vaccinated, you gotta go there.
Of course.
Yes, absolutely.
Perfect. We'll see you in a couple weeks. And thank you so much for being here again.
Thank you. Take care.